start with. Then you just position them there. I put a little pressure there if I need to. Just working on these extensors here. I don't use this near as much as the other tests. But you do that, but I don't use this one a whole lot. Most people have pretty good posterior endurance findings. That's probably the biggest portion of their issue is their imbalance between the posterior and anterior side. So you can work on that, and then have them hold that posture and move upper extremity, things like that. All right, then.
Can I say one thing about those two real quick? So one of the things to look for, if they're able to get that chin tuck and they're able to hold for over 20 seconds, the other thing you start to consider, this a whole different class and exercise prescription, that kind of stuff, but also, can they hold that chin tuck and get rotation, both in the posterior position and the anterior position, right? Because not only do those deep neck flexors have to be able to work in this position while you're laying down, but they also have to be able to be active while you're getting your rotation. Because if they shut off, as soon as I get my rotation, right, then I lose all the support. So that's the next progression to be thinking about. So for people that can do that motion, when you're testing them, then have them do some rotation or some side bending without losing that chin.
Good. Okay, so proprioceptive test. There are devices out there now. Some people just get a little cap, hard hat, the insides of that, and you put it on the head. Your C-ROM things, and you can put a little laser on it, and then have them try to do joint repositioning. So you take them, okay, this is the position I want you to reproduce. Take them back to the middle, close your eyes, and see how close they can get to reproducing that exact point. So a lot of people use like lasers and things like that. There's all kinds of devices out there, and the treatment is basically they got little mats you put on the wall that have a little maze on it, and you can have them draw through the maze and do all kinds of little proprioceptive things. But it's really looking at joint repositioning. So chin tuck, rotate. Okay, now close your eyes and do it and see if they can reproduce it. How close can they get? Should be within a few millimeters of joint reproduction. This is particularly effective with whiplash patients. That you can see a lot of those. Proprioceptive input is a big deal. So you can do flexion, extension, rotation, top movements, a lot of different things. Games, there's all kinds of cool, limited by your imagination basically, how you want to do that. So any type of trauma or whiplash patients works really effectively for. The test is basically just a joint reposition test where they go through the motion and they close their eyes and see how close they can get to the original point that you put them at. So I'll kind of tell you a little bit about proprioceptive and neural feedback. That's those ligaments. All right, any questions?
Were you resisting her head when she was in quadruped for the posterior one? Or just
I'd start them off without resistance, then just add a little bit to it.
Okay.
If
So
you want to.
Do you have to like hold for, is there a certain specification?
I usually, as a treatment, hold it for 20 seconds if I ever do this. I rarely ever do this because most people have
They're fine.
pretty good extensors. The main thing is holding that chin tuck while they're doing it, like you said. Up that out, but that's, yeah. Holding chin tuck, can they hold it in that position? I find that posteriorly, whiplash are really the only ones that I probably have used this in, just because the muscles get overstretched, ligaments get overstretched, and so it's use that to guard against any excess movement. Then you can also have them take TheraBand, loop it around the back of their head, pull on the TheraBand while they hold that position as a resistance. It's a home exercise program I use some. I'm going to do that.
Try to have a smooth head.